Pro Group Management, workers' comp that works for you.
Welcome to Nevada Newsmakers. On the broadcast today, we're joined by Pete Sepp, President of the National Taxpayers Union, and Dr. Robin Titus. She is State Senate Minority Leader, here for the whole show on an all-new Nevada Newsmakers.
Pro Group Management offers workers' comp services to a growing number of industries. As businesses grow and change with the times, the need for a solid workers' comp program must be flexible and up to date. The evolving nature of regulations can make staying ahead of complex tasks challenging. But Pro Group Management simplifies the work so your industry can move forward and succeed. Pro Group Management, workers' comp that works for you.
Like a traditional handmade basket, retail is woven into the fabric of life in Nevada. From big box to mom and pop, retail supports our communities in countless ways. Jobs for the disabled, team uniforms for kids, help for the elderly, and so much more. Retail employs over 1 in 10 workers. Retail supports Nevada, and we support retail.
RANNV.org.
As you know, Reno is booming. Toll's development company is helping it grow with insightful design and development, building community with every project, adding beauty, adding excitement, emphasizing our shared humanity. Reno is becoming bigger. Toll's development is helping it become better, more livable, more enjoyable. To learn more, go to tollsdevelopment.com. tollsdevelopment.com.
This is Nevada Newsmakers with host Sam Shad, a no-holds-barred political forum. Now, from the Nevada Newsmakers broadcast headquarters, here is Sam Shad.
And back on Nevada Newsmakers, we're always delighted to welcome back to the program Dr. Robin Titus. She is the State Senate Minority Leader, a Republican from District 17. And we're also pleased to welcome back to the program Pete Sepp. He is President of the National Taxpayers Union. Welcome to both of you.
Well, thank you, Sam. Always good to be on your show.
Thank you. Well, we're going to talk about the public option. So let's start out explaining for our audience, what is the public option and what is your problem with it?
Well, it's called the Battle-Born State Plan, and it was started in about 2021. It was an idea. It came to fruition in 2023, actually passed. And it was supposed to be an option more affordable for Nevadans who couldn't afford health care based on, because of the cost of it, and it was supposed to lower costs and increase access.
And your objection to lower, one would think under normal circumstances that you would be all in favor of lowering costs for Nevadans, right. But in this case, why not? Well,
the reality is, it's like the Affordable Care Act, which wasn't affordable nor about care. This won't lower cost and it won't increase access. And the reality is we're giving everybody bus passes, but no new buses. And so people think they have health care, but they're either uninsured, underinsured, or they can't afford the premiums, or they can't afford the deductible. And if we subsidize all of that, somebody else has to pay. There's a finite number of providers, and there's a finite access to healthcare. So who actually pays all this cost of healthcare? And we're missing the whole thing. The reality of what's the problem is the cost of healthcare in general. And that's what we have to address. And offering these plans won't solve that problem.
Okay. Pete, why is the National Taxpayers Union involved in this Nevada issue?
Well, we were founded back in 1969 and have participated in numerous citizen-based, legislative-based tax limitation campaigns from Prop 13 in California to Colorado's Tabor to Question 11 in Nevada back in 1996. A number of our members and supporters helped to qualify the initiative for the ballot that requires a two-thirds supermajority of both houses of the Nevada legislature in order to raise taxes or increase revenues, raise fees. It's a very good, tightly drawn tax limitation measure. There are a number of states in this country that require the so-called supermajority for certain tax increases, but Nevada's is particularly well drafted. It's one of the top tax limits in the country. And we believe that on behalf of our own members and supporters, the Constitution of Nevada matters. That's a big thing in this day and age, both at the federal and the state level. People are asserting their rights and trying to make sure that government plays by the rules. Government did not play by the rules with the enactment of the public option, also called Senate Bill 420.
All right, so you have gone to the Nevada Supreme Court. Where does this sit at this moment, Doctor?
Well, at this point in time, we had hoped to get an injunction that would stop it because it can't be started January 1st. And not unlike a lot of things, the courts can move slow. And so we're waiting now, and we filed the application to extension and hear it. We want it at the Supreme Court for all the reasons that Pete has said. And hopefully we move forward here. It's still in the process.
Okay, and could it, so at this point, there is a percentage of Nevadans who have actually signed up for this battle-born insurance. Would that be stopped? What would be the result if the Supreme Court agreed with your position and said, okay, we're going to have an injunction and stop it?
So the reality of the process, we have they advertised that there was going to be about 35,000 people probably signed up. Currently, it looks like it's about 8,000. We don't know the exact numbers and won't. It closed the 15th. There still will be insured, even if we put an injunction, because they went through, it's not like a make-up new plan. These had to be plans offered by insurances that are already in the state of Nevada. And
there are 8, right? Different
there's
companies.
8. So right now we know that probably of the people that searched, and we don't know the total, of the people that searched, only about 20% actually chose these plans. The other 80% chose other plans. And so whether they stay on the same plans, we'll wait to see what the court has to say about that. But believe me, there's only 8 companies here. They'll still be insured. And will they get the subsidies? And we'll just have to find how that plays out.
Okay, and for those that don't realize, you are a practicing doctor.
I am.
You both practice medicine and you also teach. So you are very well involved in this process. We have been talking, you and I and many others on this program over the years, about the lack of doctors in so many fields in Nevada. And you feel that the reimbursement rate is going to stop doctors from either coming here or force doctors to leave the state?
Well, see, what happens is these insurance companies negotiate with providers. You have to be on the plan to be reimbursed. And so you negotiate a rate that isn't what your costs are. And so you really can't stay in business anymore because of what you're reimbursed. And so that limits who's going to come here. So the providers, the primary care providers in particular, all have gone to a group practice or hospital-based practice or corporate practice because you can't afford to stay in individual practice anymore because we're not reimbursed what the actual cost is to us. And that's the reality. Medicare doesn't reimburse what it actually costs to see a patient. And I've said this before in your show. The example I would use for all those listeners is that there's a cost of doing business. At the grocery store, there's a cost to the employees at my office. Although I'm not in the office anymore, I'm still the health officer and I still do things for the schools. In the office, there's an X amount to turn on the lights. There's an X amount of dollars it costs for me to pay my employees, pay my malpractice, et cetera. And so I would bill the cost plus pay myself, and heaven forbid I might make a profit on that. But I get reimbursed less than my actual cost. Now, you can't stay in business if every time I would tell my Medicare patients, I lose money every time I see you. I'd save money by you just staying home and give me a phone call. And so that's the reality. At the grocery store, you don't show up and put that loaf of bread at the checkout aisle and say, no, 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 I don't want to pay $2.80 for that loaf of bread. I only want to pay you $1.60. The grocery store wouldn't stay open. And so that business model of how do you practice medicine in Nevada, and I think that's where it lost it. I want patients to have affordable health care. But by having government subsidies, the rest of us, the taxpayers, have to do that. And I'm going to jump in. There's a model already there. These insurance premiums already had to be subsidized at $4.5 million because they weren't offering these programs because, frankly, it wasn't because they didn't want to make money. It was because they may not be the best option for their clients. And so now there was $4.5 million subsidized that we're paying brokers. I'm not even sure that's legal, that we can pay a broker to refer somebody to sign up. So it's a sign up bonus they get if they sign somebody up to it.
Pete, you're nodding your head here in agreement.
Yeah, it's absolutely correct. And it really underscores the three arguments that we're making in this lawsuit. The first argument being that the public option definitely does raise revenues. The various premiums and outflows and inflows are subject to insurance premium taxes, like lots of other health plans. The legislature decided to pass this without the required supermajority of the Constitution. We also argue that the law requires that appropriations occur by the legislature for public expenditures. That's a process that ensures accountability. This law sets up a public option trust fund without that accountability. Our third argument has to do with separation of powers. The legislature is supposed to guide the basic precepts of the public option, and yet the law has delegated impermissibly, in the opinion of this lawsuit, these powers to the Treasury and the Department of Health and Human Services. And so this is not just about a violation of the supermajority taxpayer protection. It's about other parts of the Constitution too, and we've got to get this right for taxpayers and patients.
Okay, now when you say that, are you referring to that on a federal level or on a state level?
Which part of the
the different departments that
Oh, this is the state level.
This is all on the state level. Okay,
Yeah.
So Dr. Titus, this was pushed by State Senator Nicole Cannizzaro, who is now running for Attorney General. What are your thoughts on why she did this, and if it is, as you suggest, not working under the Constitution of the state of Nevada, doesn't that implicate her in a kind of problematic situation in her next job application?
Well, in all fairness, this has been going on for a number of sessions before she decided to run. Well, I don't know when her decision to run for Attorney General actually was, but this has been going on for several sessions now. And we dealt with it, in my mind, during the 21, 23 sessions where they had the trifecta in the legislative process, where we had Democrat governor, we had both houses were Democrat controlled. And at the time the bill was first introduced, it was really looking at a national healthcare system. And Nevada was the test state for many things that went on there to see what we could get passed, what would work. And it was initially saying, well, we're going to just look at this, what's it going to cost? And at the time, I remember speaking to the majority leader in the assembly saying, we can't, this will never be affordable. And I was told that, we know, but we're going to run this through and it'll show that we can't afford it. But then the things kind of trickle in, and then it keeps moving down the road, and it keeps getting kicked down that road. And here we are today where we're trying to implement it.
All right. So who's the beneficiary? If it's not the patient and it's not the doctor, who's the beneficiary?
Amazon, Walmart, other companies that don't pay their employees enough to have insurance. The top two companies in this state that have Medicaid, their employees on Medicaid, number one is Amazon, number two is Walmart. So we're subsidizing these huge corporate entities that they don't have to pay their employees enough. So the state's going to say, hey, you don't have to pay your employees enough to get insurance. The state will help them. And it's just wrong. There's solutions to the cost of health care. This is not one of these. This is on the back of the Nevada taxpayers.
Okay, so are these companies lobbying you and the legislature on this issue?
These companies, I would say not directly, but we know that the owner of Amazon is one of the major contributors to the Democrat Party. You tell me how that works.
All right. One other thing before we go to a break here. You mentioned Medicare when you were talking about the lack of affordability for the provider to provide that service to a Medicare patient. And as somebody who is on Medicare, and I have to say that from my perspective, it's a wonderful thing because you look at what the original pricing is and then you look at what the government says is okay. From my perspective, it's very beneficial. I would have thought that Medicaid was the problem for providers, but you're saying that even Medicare is a problem.
Absolutely. And by the way, I'm on Medicare too. And so
you're too young for it.
Yeah, I've been on Medicaid for a while. I won't say how long, but a while. And so I understand the cost of what Medicare does and doesn't pay for providers. And we're trying to make it affordable, and they're trying to come up with the reimbursement so that patients can see doctors. When I was in the office seeing patients, I would see whoever walked through my door. I did not do a wallet biopsy before I saw them. I would take care of them. The issue was then getting them to the specialist. And all these programs really are good. It will be fine for, as a primary care doc, the PAs and nurse practitioners and all those initial folks that you see, but it's getting them to the specialist that's the issue. And what you have to do is offset, like in any insurance premium, you have to, or any insurance, you have to offset those who pay. And then your insurance bills are higher because we're offsetting what Medicare doesn't pay us and what Medicaid doesn't pay us. So you have to have a reasonable practice in order to stay in practice, or you have to be subsidized. You have to have some sort of additional funding, like our local hospital in Yerington. We can stay open based on that patient ratios of who actually pays and reimburses versus who we have to subsidize in order to stay open. So we became a county agency where we actually have a tax base to help us stay open, or you can't survive that. Somebody's always paying the bill. The question is, how do you offset that?
All right, so Pete, on a national level, is there a state that's doing this right?
I wish I could say there was. Unfortunately not. Colorado and Washington have tried this public option experiment, and it hasn't worked out well. It hasn't necessarily increased the quality of care, the affordability of care, the number of people who are getting care. And all of these goals that public option advocates keep saying we can reach with this scheme, we don't reach them. And we've got to find better ways to provide affordable, quality care. I think Dr. Titus has hit on several themes that would suggest a better direction.
All right, let's take a break. We'll come back much more on this very important topic after this timeout.
Welcome to Story County, where history meets innovation, and a pioneering spirit continues to shape our future. At the heart of the Tahoe Reno Industrial Center, we power the future with global leaders in technology and manufacturing, driving progress that reaches far beyond our county lines. From advanced manufacturing to tech innovation, our industries are creating thousands of quality careers, fueling a vibrant economy that benefits every Nevadan. But it's more than just growth. Our community is our foundation, supporting families, empowering local initiatives, and creating a place where everyone belongs. Be part of a legacy built on bold ideas and boundless possibilities. Join us in building a brighter future right here in Story County. Story County, helping build Nevada's future.
The new year is bringing new ways to win big during the $175,000 Winter Wonderland giveaways at Tamarack Casino. Win up to $5,000 in cash every week and a top prize of $20,000 in cash during the grand finale drawing. Your good times are at Tamarack Casino.
The trucking industry is the most resilient link in the supply chain, moving 95% of our freight in the Silver State. And while essential, the road isn't always smooth. Supply chain disruptions, rising fuel costs, and unrealistic rules and laws that hamper our ability to serve our customers and country. Our prosperity in every sector of the economy, manufacturing, mining, medicine, and food from farm to table, is tied to trucks. There's nothing without trucking.
This is Nevada Newsmakers.
And back on Nevada Newsmakers, we continue our conversation about the public option that came into play at the beginning of this year with Dr. Robin Titus, the State Senate Minority Leader, and Pete Sepp, the President of the National Taxpayers Union. All right, so if you're successful with the public option, what would you like to see done? Because, you know, when we first started this program over 20 years ago, Larry Mathias was the head of the Nevada State Medical Association, and he said to me at one point that Obamacare was just one piece, that the whole reform of healthcare was so much bigger than that. We never got to discuss how much bigger than that it was, but where should we be going?
Well, I think the healthcare system is probably the most regulated system of anything that we have in our nation. We know that other countries have better outcomes than we do, and they pay less. So what is the reality here? I am not against physicians making a profit. For heaven's sakes, it's a business. And I was in the business, and I couldn't afford to stay in the business. And so to get good quality, to get good research, we want to be the forefront of everything. But how do we do that and keep our costs down? There's a lot of things like transparency, I think, would be super important. Like, what does it cost to go have an MRI if I'm a cash-paying patient? Like you, I'm a Medicare. I have Medicare Part A and Part B. But instead of paying an insurance company to do what A and B won't pay, I put money away in a savings account every month so that I can pay up the difference if I have some sort of test that I need. But I want to be able to call, if I'm paying for that, I want to be able to call around and for the MRI scanners and say, well, what do you charge for your 16 slice?
Do you really do that?
I do. What do you charge for that? If I'm going to pay cash, I want to know what it costs. So transparency for those of us that pay cash, because we know we get a discount if we pay cash. There's something called cash clinical for labs. So if you have a huge deductible, and and that's the other thing, deductibles are going up. So those of us who have insurance that we pay for, we're paying for all this offset that we're talking about today. So your deductible is probably going to go up, and mine's probably going to go up. So we offset that by finding out, well, what do things cost? So transparency is a huge thing. And then I think hugely would be making businesses over X a number of employees make sure they pay for their employees' health insurance. I think there has to be accountability. So I have lots of ideas.
All right, let's take another break and we'll be right back.
A power line is more than a power line. It's maintaining the bottom line for small businesses. It's keeping the assembly line moving for our workforce. For our brightest minds, it's meeting a deadline. It's on the front line with our heroes. And on the sidelines of the biggest games. It's a direct line to our loved ones. And it's a lifeline for the most vulnerable. There's a lot on the line.
For 50 years, Nevada Heating has been keeping people comfortable in their homes. At Nevada Heating, call the Do It Right guys and get the heat back on today. Call us today and we'll fix it today. That's the Nevada Heating way. Why freeze for days on end when Nevada Heating can get your furnace fixed today? Call us today and we'll fix it today at 323-5585 or schedule us on our website at nevadaheating.com.
The Nevada Builders Alliance has been protecting the interests of the construction industry for over 50 years. Our programs save members thousands of dollars every year and allow them to provide much-needed benefits to their employees. Our industry also allows Nevada to grow. If you're thinking about a career in the construction industry, reach out. And if you haven't thought of a career in construction, what are you waiting for? We are the Nevada Builders Alliance.
Welcome to the Ahern Boutique Hotel, where luxury and warmth come together in the heart of Las Vegas.
We take pride in offering a one-of-a-kind experience for for both locals and tourists.
Join us for handcrafted cocktails and an unforgettable experience. Joel's Chop House, the perfect place to savor views of the Las Vegas Strip.
Satisfy your cravings at the Ahern Chocolate Shop.
No smoking, no resort fees, and the parking is always free. The Ahern Luxury Boutique Hotel is your home away from home.
This is Nevada Newsmakers.
And back on Nevada Newsmakers, we're talking about the public option that kicked in at the beginning of this year with Dr. Robin Titus, the state Senate minority leader, and Pete Sepp, the president of the National Taxpayers Union. Your final thoughts here, Pete.
Well, there are a lot of exciting reforms happening at the federal level. The One Big Beautiful Bill Act that just passed expanded health savings accounts so that Americans can have more control over their health care dollars. There are topics like site neutrality and reforming the discount drug program called 340B. Those are all important discussions, but there's also one going on right here, right now in Nevada. And Nevadans have to ask themselves, do they want a healthcare system that empowers patients, rewards innovation, respects the Constitution and taxpayers, or do they want one that expands government control? That's the issue at hand here with the public option and our lawsuit. We'll see what the Supreme Court decides.
All right, and Senator Titus, your last thoughts? We've got about 15 seconds.
Well, thanks, Pete, for that synopsis. I can't improve on that, but I want to really focus about patients and patient care and affordability and accessibility. And at the end of the day, my goal has always been making sure patients have access to care. This bill did not do that.
All right, and that's where we have to leave it. More to come after the Supreme Court rules. Thank you both very much. We'll be right back.
You're in trouble with the law. It's easy to think you'll lose everything, but there is hope. I'm attorney Orrin Johnson. Your first step is to hire a serious attorney with the experience to successfully navigate the legal system for you.
Sometimes hope means addiction treatment instead of jail, and making sure you're treated fairly.
Sometimes hope means fearless trial attorneys who will stand up to the government when they get it wrong. Call or text Orrin Johnson Law.
We'll make a plan.
You'll take back your life.
Ring in the new year with newfound cash during the New Year Cash Extravaganza only at the Carson Valley Inn. Win up to $7,500 in giveaways every week. Then win big with $10,000 in cash and free play during the grand prize party January 31st. Start 2026 with a bang only at the Carson Valley Inn.
Each day, the Children's Advocacy Alliance partners with leaders, legislators, and families across Nevada to improve children's health, education, economic well-being, and safety. We recognize Nevada will be no better than the state of its children. Be a part of this change. Be a supporter of the Children's Advocacy Alliance. For more information, go to caanv.org.
Imagine a magical garden that feeds Carson City's hungry and homeless, teaches our high school students agriculture, creates hanging floral displays to beautify downtown, and yet charges nothing. It's not magic. It's the Greenhouse Project. It's real, it's growing, and it needs your help. Go online to carsоncitygreenhouse.org so together we can grow it forward.
Check out our archives section on NevadaNewsmakers.com. Great interviews going back as far as 2002. Really worth watching. We'll see you on the next podcast.